Your doctor prescribed you a medication to fix one problem, and now you're taking 3 more medications to manage the side effects of the first one. That medication for your cholesterol caused muscle pain, so you were given pain medication. The pain medication caused constipation, so you were given a laxative. The laxative caused electrolyte imbalances, so now you're on supplements to correct that. And throughout all of this, nobody has addressed why your cholesterol was high in the first place. This isn't an isolated scenario, this is the standard pattern of modern medical care for millions of people, particularly those over 50. The average person over 65 in the UK is on 5 prescription medications. In the US, it's closer to 7, and each one of those medications comes with side effects that often require additional medications to manage, creating a cascade that leaves people on 10, 15, or 20 different pills per day. But here's what almost nobody talks about. Modern medicine is extraordinarily good at keeping you alive through acute crises. If you have a heart attack, a stroke, a traumatic injury, or a severe infection, modern emergency medicine and surgery can save your life in ways that would have been impossible 50 years ago. The problem is that the same medical system that excels at acute intervention has built an entire chronic disease management model that doesn't actually make people healthier. It manages symptoms, it suppresses warning signals, it treats numbers on lab work without addressing the underlying dysfunction. And in many cases, the treatments themselves create new problems that require more treatments, until patients are trapped in a cycle of declining health despite doing everything their doctors tell them to do. This isn't a conspiracy, it's not that doctors don't care or that medicine is deliberately harming people. It's a systemic problem with how modern medicine is structured, how doctors are trained, how success is measured, and how the pharmaceutical industry influences treatment decisions. And if you understand what's going wrong and why, you can start making choices that work with the parts of medicine that help and avoid the parts that harm. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AAN, EA, I've worked within this system long enough to see both its extraordinary capabilities and its fundamental limitations. I've saved lives with medications, interventions, and procedures that are genuine miracles of modern science. But I've also watched patients deteriorate over years as they accumulated more diagnoses, more medications, and more complications, all while following their doctor's advice exactly. My goal now is to help people understand how to navigate the medical system intelligently, to use it for what it's genuinely good at, while avoiding the traps that can make chronic disease worse rather than better. Now, I know this is a controversial topic, and you might be wondering if this channel is worth your time. So let me make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in evidence and clinical experience to help you make informed decisions about your health. I'm not anti-medicine, I'm a doctor, but I'm committed to telling you the truth about what works, what doesn't, and what might actually be making things worse. All I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you don't think it was worth your time, or you haven't learned something genuinely useful, then feel free to unsubscribe. No hard feelings whatsoever, but if you give me your time and attention, I'll give you everything I've learned from over a decade working inside this system. So please help me out. Hit that subscribe button to help this channel reach more people like you, and let's continue with the video. To understand where modern medicine goes wrong with chronic disease, we need to start with understanding how the system is designed and what it's optimized for. Medical education trains doctors to diagnose and treat disease. The entire framework of medical school and residency is built around pattern recognition. You learn to identify symptoms, order the right tests, match those findings to a diagnosis, and prescribe the appropriate treatment according to guidelines. This system works brilliantly for acute problems. Someone comes in with crushing chest pain radiating to their left arm. You recognize that pattern, you do an ECG, you diagnose a heart attack, and you activate the catheterization lab to open the blocked artery. That patient's life is saved because of this system. But chronic disease doesn't fit this model. Chronic diseases like diabetes, hypertension, heart disease, and metabolic syndrome aren't singular events that can be fixed with a procedure or a course of medication. They're the result of years or decades of accumulated dysfunction caused by diet, lifestyle, stress, sleep deprivation, environmental toxins, and genetic susceptibility. They develop slowly, they involve multiple organ systems, and they require addressing the root causes, not just suppressing the symptoms. But medical training doesn't focus on root causes. It focuses on managing the manifestations of disease after they appear. When someone is diagnosed with type 2 diabetes, the medical approach is to prescribe metformin to lower blood sugar. And if that doesn't work, add insulin or other medications to bring blood sugar into the target range. The goal is blood sugar control measured by HbA1c levels. If HbA1c is below 7%, the treatment is considered successful. But nobody asks why that person became diabetic in the first place. What dietary patterns led to insulin resistance? What level of visceral fat is driving the metabolic dysfunction? What sleep quality, stress levels, or activity patterns are contributing? Those questions aren't part of the standard medical appointment because doctors aren't trained in depth on nutrition. They're not trained to coach behavior change, and they don't have time in a 10 or 15-minute appointment to address lifestyle comprehensively. So the system defaults to medication, which is quick, measurable, and fits within the time constraints of modern medical practice. The problem is that medication without lifestyle change doesn't reverse diabetes. It manages the symptoms while the underlying disease process continues. The patient's insulin resistance worsens over time, requiring higher doses of medication, then additional medications, then eventually insulin injections. Their weight increases because insulin promotes fat storage. Their cardiovascular risk increases. Their kidney function declines. They develop neuropathy, retinopathy, and all the other complications of diabetes. And throughout this progression, their blood sugar numbers look acceptable on paper because medication is controlling them. The disease is advancing while the measurements suggest it's managed. This pattern repeats across chronic diseases. High blood pressure is treated with antihypertensive medications that lower blood pressure but don't address why it's elevated. High cholesterol is treated with statins that lower LDL cholesterol but don't address the inflammation and metabolic dysfunction that are the actual drivers of cardiovascular disease. Chronic pain is treated with opioids that mask pain but don't address the underlying injury, inflammation, or biomechanical problem causing it. Depression is treated with antidepressants that alter neurotransmitter levels but don't address the sleep deprivation, nutritional deficiencies, lack of physical activity, social isolation, or chronic stress that are often the root causes. None of this is necessarily wrong in the short term. Sometimes medication is essential to prevent immediate harm. Someone with blood pressure of 180/120 needs medication immediately to prevent a stroke, while lifestyle interventions are implemented. Someone in severe depression needs medication to stabilize them, while other interventions are put in place. The problem is that the medication becomes the treatment indefinitely, and the root causes are never adequately addressed. Patients are told to take their medication, and they'll need to take it for life. And because the underlying dysfunction continues, additional problems develop that require additional medications, and the cascade accelerates. Now let's talk about medication side effects, because this is where the system really starts causing harm. Every medication has side effects. That's not a flaw, it's a fundamental reality of pharmacology. Medications are designed to alter specific biological processes, and those processes don't operate in isolation. When you take a statin to lower cholesterol, you're inhibiting an enzyme called HMG-CoA reductase that's involved in cholesterol synthesis. But that same enzyme is involved in producing coenzyme Q10, which is essential for mitochondrial energy production. Statins deplete CoQ10, which can cause muscle pain, fatigue, and in rare cases, serious muscle breakdown. When you take a proton pump inhibitor to reduce stomach acid for reflux, you're turning off the acid production that's causing discomfort. But stomach acid is essential for absorbing vitamin B12, calcium, magnesium, and iron. Long-term PPI use leads to deficiencies in these nutrients, which causes anemia, bone loss, muscle weakness, and neurological problems. When you take a diuretic to lower blood pressure by reducing fluid volume, you're also losing potassium, magnesium, and sodium in the urine, which can cause electrolyte imbalances, muscle cramps, and heart rhythm disturbances. When you take a corticosteroid for inflammation or autoimmune conditions, you're suppressing your entire immune system, which increases infection risk, causes weight gain, raises blood sugar, weakens bones, and can cause mood disturbances. Most patients aren't adequately informed about these side effects before starting medication. They're told the medication will help their primary problem, and side effects are mentioned briefly, if at all. When side effects do develop, they're often not recognized as being caused by the medication. A patient on statins develops muscle pain and fatigue. They mention it to their doctor, but because these are common symptoms that could have many causes, the connection to the statin isn't made immediately. Instead, the patient is told they're getting older, or maybe they need to exercise more, or perhaps they're depressed. Eventually, a pain medication might be prescribed to manage the muscle pain. The fatigue continues, so thyroid function is checked and found to be slightly low, so thyroid medication is added. The patient is now on 3 medications, when the original problem was a side effect of the first medication that could have been addressed by stopping or changing the statin. This pattern is called a prescribing cascade, and it's extremely common. Research published in JAMA Internal Medicine found that prescribing cascades occur in up to 30% of patients on multiple medications. One medication causes a side effect, the side effect is misinterpreted as a new medical problem, and a new medication is prescribed to treat it. This continues until patients are on a dozen medications, many of which are treating side effects of other medications rather than actual diseases. The pharmaceutical industry's influence on this system cannot be ignored. Drug companies fund the majority of medical research, particularly clinical trials that get medications approved. They fund continuing medical education for doctors. They employ sales representatives who visit medical offices to promote their medications. And they spend billions on direct-to-consumer advertising, convincing patients to ask their doctors for specific drugs. This creates a system where the evidence base for medication use is heavily biased towards showing benefit and minimizing harm, where doctors receive most of their ongoing education from sources with financial conflicts of interest, and where patients arrive at appointments already primed to request specific medications they've seen advertised. None of this means medications don't work or aren't necessary. It means that the incentive structure is set up to maximize medication use rather than to minimize it. A drug company makes no money from telling you to lose weight, exercise, sleep more, and manage stress. They make money from selling you medication. And because medical practice is built around guidelines that are heavily influenced by industry-funded research, the default treatment for almost every chronic condition is pharmaceutical. There's also the problem of what success looks like in modern medicine. Success is measured by biomarkers and adherence to guidelines. If your blood pressure is below 140/90, your diabetes treatment is successful. If your LDL cholesterol is below 100, your statin therapy is successful. If your HbA1c is below 7, your diabetes is well controlled. But these are proxy measures. They're not measuring health. They're measuring numbers that correlate with health outcomes in population studies. And there's a dangerous assumption that if the numbers look good, the patient must be healthy. But I've seen countless patients whose numbers look perfect on paper, who feel terrible. They're fatigued, weak, mentally foggy, losing muscle mass, gaining fat, and progressively less functional, despite having blood pressure, cholesterol, and blood sugar in the target ranges. Their doctors tell them everything looks good, their labs are fine, they should keep doing what they're doing. But the patient knows something is wrong because they can feel it. Their quality of life is declining, they're less capable than they were 5 years ago. They're accumulating more medical problems. But because the numbers look acceptable, the system declares success and continues the same approach. Okay, so if you're watching this video, you're probably concerned about your health, possibly frustrated with the medical care you've received, and looking for a better approach. I just want to take a few seconds here to remind you that I promise to keep creating the most helpful videos I possibly can, grounded in evidence and real clinical experience, to help you make better decisions about your health. All I ask in return is that you give this channel a chance and hit the subscribe button to help me reach more people like you. If you get to the end and didn't think it was worth your time, feel free to unsubscribe. But if you give me your attention, I'll give you everything I've learned from over a decade in medicine. So please help me out and hit that subscribe button. Let's continue with the video. So what do you actually do about this? How do you navigate a medical system that's genuinely life-saving in acute situations, but potentially harmful in chronic disease management? The first principle is to understand that medication should be a bridge, not a destination. When you're diagnosed with a chronic condition, medication may be necessary to control symptoms and prevent immediate harm while you address the underlying causes. But the goal should always be to reduce or eliminate medication by resolving the dysfunction that made it necessary in the first place. For most chronic diseases, particularly metabolic diseases like diabetes, hypertension, and high cholesterol, this is possible. Research has shown that sustained weight loss, particularly reduction of visceral fat, combined with regular exercise, adequate sleep, and stress management, can reverse type 2 diabetes, eliminate the need for blood pressure medication, and normalize cholesterol without statins. But this requires genuine lifestyle change, not just taking a pill and hoping for the best. And it requires persistence, because metabolic healing takes months or years, not weeks. The second principle is to question every medication you're prescribed. This doesn't mean refusing medication, it means having an informed conversation with your doctor about whether the medication is necessary, what the alternatives are, what the side effects are, and what the plan is for eventually reducing or stopping it. Ask your doctor what would happen if you didn't take this medication. Ask what lifestyle interventions might reduce or eliminate the need for it. Ask how long you'll need to be on it. Ask what side effects to watch for. And if you're already on multiple medications, ask your doctor to review them and assess whether all of them are still necessary. Polypharmacy, which is being on multiple medications, is itself a risk factor for adverse outcomes. The more medications you're on, the higher the risk of drug interactions, side effects, and prescribing cascades. Many patients who undergo a careful medication review with their doctor find that several of their medications can be stopped or reduced without any negative consequences. The third principle is to prioritize functional capacity and quality of life over lab values. Your goal should not be to have perfect numbers on blood work. Your goal should be to be strong, energetic, mentally sharp, and capable of doing the things you want to do for as long as possible. If achieving perfect lab values requires medications that make you feel terrible, that's not success, that's a trade-off that might not be worth making. There are situations where lab values matter enormously. If your blood sugar is 400, that needs to be brought down immediately because acute hyperglycemia is dangerous. But if your LDL cholesterol is 130 instead of 100, and you feel great, have good functional capacity, and are actively working on improving your diet and exercise, the marginal benefit of adding a statin to get that number down might not outweigh the risk of side effects and the disruption to your quality of life. This is a conversation to have with your doctor, not a decision to make unilaterally. But it's a conversation worth having because the default in medicine is to treat the number, not the person. The fourth principle is to invest in preventive behaviors that actually address root causes. This is where modern medicine fails most profoundly. The system is reactive, not proactive. It waits for disease to develop and then treats it. But the most powerful interventions for chronic disease are preventive, and they don't involve medication. Resistance training to build and maintain muscle mass is one of the most important things you can do for metabolic health, bone health, and functional independence as you age. But most doctors don't prescribe it. Eating a diet based on whole foods with adequate protein and minimal processed food and refined carbohydrates prevents or reverses the majority of metabolic disease. But most doctors receive minimal nutrition training and don't have time to provide dietary counseling. Getting 7 to 9 hours of quality sleep consistently regulates hormones, improves insulin sensitivity, strengthens immune function, and supports cognitive health. But sleep is rarely addressed in medical appointments unless you specifically bring up insomnia. Managing chronic stress through mindfulness, social connection, or other stress reduction practices has measurable effects on inflammation, blood pressure, and metabolic function. But mental health and stress management are siloed into separate appointments with different specialists rather than being integrated into overall health management. These interventions don't generate revenue for the medical system. They're not patentable, they can't be prescribed in a 10-minute appointment, but they're more powerful than the majority of medications for preventing and reversing chronic disease. You have to take ownership of these areas yourself, because the medical system largely won't. The fifth principle is to find doctors who practice functional or integrative medicine, or at least conventional doctors who are open to a root cause approach. Not all doctors practice the standard symptom management model. There are doctors who prioritize lifestyle intervention, who take time to understand the full picture of what's contributing to your health problems, and who see medication as a temporary tool rather than a permanent solution. These doctors are often harder to find, and they're sometimes not covered by insurance, but if you're dealing with chronic health issues that aren't improving with standard care, it's worth seeking them out. Look for doctors who emphasize metabolic health, who talk about insulin resistance and inflammation as underlying drivers of disease, who recommend dietary changes and exercise as primary interventions, and who are willing to deprescribe medications when appropriate. These doctors exist within the conventional medical system, but you have to seek them out deliberately. The sixth principle is to be extremely cautious with polypharmacy, particularly in older age. The more medications you're on, the harder it is to know what's helping and what's harming. If you're on 10 medications and you develop a new symptom, which medication is causing it? If you're not feeling well, is it because of your medical conditions or because of the medications treating them? And as you age, your kidney and liver function decline, which means medications are metabolized more slowly and accumulate to higher levels in your system, increasing the risk of toxicity. Research has shown that in elderly patients, reducing the number of medications often improves quality of life, reduces falls and cognitive impairment, and sometimes even extends lifespan compared to staying on many medications. This needs to be done carefully under medical supervision, but it's worth pursuing if you're on many medications and not feeling well. And finally, the seventh principle is to understand that acute medicine and chronic disease management are fundamentally different, and you need different approaches for each. If you have a heart attack, an infection, a stroke, or a traumatic injury, you need modern emergency medicine. You need hospitals, specialists, procedures, and medications that can save your life. Don't avoid medical care in acute situations because you're skeptical of how medicine handles chronic disease. The system is genuinely excellent at acute intervention. But for chronic disease, you need to be more skeptical, more informed, and more actively involved in your own care. The default pathway of medication without lifestyle change will likely lead to more medications, more side effects, and progressive decline despite having controlled lab values. You can do better if you understand the system's limitations and take responsibility for the things the system doesn't prioritize. In emergency medicine, I see both ends of this spectrum. I see people who avoided medical care for acute problems out of mistrust or skepticism, and by the time they come in, what could have been treated easily has become life-threatening. Don't be that person. Use emergency medicine when you need it. But I also see people who have been in the chronic disease management system for decades, who are on 15 medications, who are progressively weaker, more fatigued, more cognitively impaired, and more functionally limited despite following their doctor's advice. Their medications are managing their numbers, but they're getting sicker in every way that matters. They've lost muscle mass, they've gained visceral fat, they're falling more, they're in and out of hospital with infections, heart failure exacerbations, and medication complications. And often, when we review their medication list, half of the medications are treating side effects of the other medications. Stopping several medications with careful monitoring often makes them feel dramatically better. I've also seen patients who took control of their health, who lost weight through resistance training and dietary change, who eliminated processed foods and prioritized sleep, and who worked with their doctors to reduce medications as their health improved. These patients come back for follow-up visits and they're unrecognizable. They're off most of their medications, their lab work is better than when they were on medications. They have more energy, they're stronger, they look younger. They've avoided the progression into disability and dependence that seemed inevitable. Those transformations are possible, but they require understanding that the standard medical approach to chronic disease is insufficient. Medication manages symptoms. Lifestyle change addresses causes. Both have their place, but lifestyle change should be the foundation, with medication used temporarily when necessary, not the other way around. What all of this comes down to is recognizing that modern medicine is a tool, not a religion. It's extraordinarily powerful for certain applications and deeply flawed for others. The system is optimized for acute intervention and symptom management, not for preventing disease or addressing root causes. It's influenced by financial incentives that favor pharmaceutical intervention over lifestyle intervention. It's constrained by time, training, and reimbursement structures that make comprehensive care difficult. And it measures success by biomarkers rather than functional capacity and quality of life. None of this makes medicine evil or useless. It makes it limited. And if you understand those limitations, you can use the parts that help while avoiding the parts that harm. You can use medication when it's genuinely necessary, while simultaneously working to address the underlying dysfunction, so you don't need it long term. You can maintain a relationship with doctors for acute care and monitoring while taking responsibility for the preventive behaviors that actually keep you healthy. You can be informed about medication side effects and proactive about stopping medications that aren't helping. And you can refuse to accept decline as inevitable just because your numbers look good on paper. The tragedy of modern medicine isn't that it doesn't work, it's that it works brilliantly for acute problems, but fails at chronic disease because it's not designed to address root causes. And millions of people are trapped in a system that keeps them alive but progressively sicker, all while telling them they're being well managed because their lab values are controlled. You deserve better than that. You deserve to be strong, energetic, and functional into your 70s and 80s and beyond. And that outcome is possible, but it requires understanding that medication is not health, controlled lab values are not wellness, and following standard medical advice without question often leads to progressive decline despite apparent success on paper. Take what modern medicine does well, use it when you need it, but don't mistake symptom suppression for healing. Real health comes from addressing causes, and that's work you have to do yourself. Please subscribe to this channel if you found this useful to help me reach more people who deserve to understand how to navigate the medical system intelligently. Thanks for watching, and I'll see you in the next one.